So during the last video, I said that clozapine is one of the most tested medication on ANCC exam. So today we are going to be taking practicing together 20 clozapine high yield questions. So I want you to take a look at these questions, look at the options, and also look at the rationales. There are some important points that you will need to remember for your ANCC exam. So let's look at the number one question. Number one says, a 28-year-old male with schizophrenia has failed 2 antipsychotic trials and continues to have severe suicidal ideation. Which is the best next treatment option? We have 1, risperidone, clozapine, haloperidol, and olanzapine. And here we say the answer is clozapine. If you look at the rationale, it says clozapine is the only FDA-approved medication for treatment-resistant schizophrenia and for reducing suicidal behavior in patients with schizophrenia or schizoaffective disorder. You need to remember this for your exam. Number 2, before initiating clozapine, which lab test is mandatory? A, fasting blood glucose, absolute neutrophil count, prolactin level, and serum creatinine. The answer is A and C. Remember, clozapine causes agranulocytosis, and a baseline ANC is required and must be monitored regularly. Number 3, at what ANC level must clozapine be discontinued immediately? A says less than 2,000, B says less than 1,500, C says less than 1,000, and D says less than 500. I'm going to say for this, for ANCC, if they don't indicate that the patient have severe neutropenia, I would like you to choose the answer that says less than 1,000, because this 500 is for people that have severe neutropenia. But for all other population, if ANC is less than 1,000, you need to discontinue the clozapine immediately. Number 4, clozapine carries a black box warning for all the following except 1, agranulocytosis, B, seizures, C, myocarditis, D, tardive dyskinesia. The answer is tardive dyskinesia. The rationale here says clozapine has black box warning for agranulocytosis, seizures, myocarditis, orthostatic hypotension, and increased mortality in elderly with dementia psychosis, but not tardive dyskinesia. So you need to remember this in your during your exam. If you see this question, remember this. Number 3 says, which of the following side effects is most strongly associated with clozapine compared to other antipsychotic? A says galactorrhea, B, severe constipation, C, akathisia, and D, ocular changes. If you look at our answer, it says severe constipation. Clozapine is associated with life-threatening constipation and paralytic ileus. You need to remember this. Number 6 says a patient stabilized on clozapine is admitted to the hospital and stops smoking suddenly. What adjustment may be needed? A, increase clozapine dose. B, decrease clozapine dose. C, no change. D, add another antipsychotic medication. Our answer here is decrease clozapine dose. Tobacco smoke induces CYP1A2 metabolism of clozapine. So stopping smoking reduces clearance, raising the drug level. And I mentioned this in my last video. If you have not watched the video is on my channel. Number 7 says, what factor most increase the risk of seizure with clozapine? A, concomitant SSRI use. B, high dose, like greater than 600 milligram per day. C, low sodium diet, and D, mild anemia. The answer here is high dose, especially when you give clozapine greater than 600 milligram a day, there is that risk of seizure. Clozapine has a dose-related risk of seizure, especially at high doses. You need to remember this. Number 8, a 25-year-old male started on clozapine 2 weeks ago, present with fever, chest pain, and dyspnea. What adverse effect must be suspected? We have NMS, we have myocarditis, pulmonary embolism, and tardive dyskinesia. So the answer here is myocarditis. Rationale: because clozapine can cause myocarditis usually within the first month of start. You need to remember that. Number 9, a patient on clozapine developed neutropenia with ANC level of 800. The drug was discontinued. Which statement is most accurate? A, clozapine should never be restarted. B, rechallenge is possible with hematology consultation. C, restart immediately at a lower dose. D, switch to depot haloperidol. The answer here is rechallenge is possible with hematology consultation. Some patients may be rechallenged if benefit outweighs the risk. You need to remember that. Which of the following is true regarding clozapine use in elderly patients with dementia-related psychosis? A says it is FDA approved in this population. B, it increases mortality risk. C, it reduces fall risk. And D, it is first line in dementia psychosis. The answer here is that it increases mortality risk. This I also mentioned in my last video. If you have not watched it, you can refer to my video on my channel where I talked about the clozapine. All antipsychotics, including clozapine, carry a black box warning for increased mortality in elderly patients with dementia psychosis. So with elderly patients and children, you have to be careful when administering all the antipsychotic medications. A patient reports feeling extremely drowsy after starting clozapine. Which is the best management strategy? A, stop clozapine immediately. B, switch to haloperidol. D, dose at bedtime and titrate slowly. And D, add a benzodiazepine. The answer here is C, dose at bedtime and titrate slowly. Clozapine causes the sedation, so bedtime dosing and slow titration are the safest. Number 12 says, why must patients taking clozapine be enrolled in clozapine REMS program? A, to monitor liver enzyme. B, to prevent OT prolongation. C, to ensure ANC monitoring. D, to monitor metabolic syndrome. The answer here is C, to ensure ANC monitoring. Clozapine REMS ensure ANC monitoring due to the risk of granulocytosis. Remember that. Number 13, a patient on clozapine experiences dizziness when standing. What is the most likely cause? A, prolactin elevation. B, orthostatic hypotension. C, EPS. D, hyponatremia. The answer is orthostatic hypotension. Clozapine is an alpha adrenergic blockage that causes orthostatic hypotension. That is one of the side effects. You have to remember that. Which metabolic effect is clozapine most strongly associated with? A, weight gain and diabetes. B, hyperprolactemia. C, low cholesterol. And D, anorexia. The answer here is weight gain and diabetes. Clozapine has the highest risk for metabolic syndrome. Remember that clozapine is a second generation antipsychotic medication, and they are famous for metabolic syndrome, and clozapine is one of them. A patient complains of bothersome nighttime drooling on clozapine. Which is the best intervention? Increase clozapine dosage, add glycopyrrolate, stop clozapine immediately, add haloperidol. The answer here is you have to add the glycopyrrolate. This is a medication that can help with drooling. Clozapine is uniquely causes siluria, that is nighttime drooling. So you need this medication to help your patients. Number 16, which of the following statements about clozapine and NMS is true? Clozapine never causes NMS. Clozapine has a lower risk of EPS and NMS. Clozapine always causes NMS in the first month. Clozapine has highest risk of MNS. The answer is B. Clozapine has a lower risk of EPS and NMS. Remember that we mentioned this, that clozapine has the lowest risk of EPS, and also I mentioned it in my other video. So clozapine rarely causes EPS or NMS compared to other antipsychotic medications. Why should clozapine be used with caution with benzodiazepine during initiation? A, risk of agranulocytosis increase, risk of seizure decreases, risk of respiratory depression increases, risk of prolactin elevation increases. The answer here is C. Risk of respiratory depression increases. Combining clozapine with benzodiazepine can cause severe respiratory depression. So even when you are practicing, you need to be careful combining this medication, and also you need to remember this during your ANCC exam, because ANCC want to know that you're going to be a safe provider. Number 18. When is clozapine induced myocarditis most likely to occur? A, first 2 weeks of treatment. B, after 1 year of treatment. C, at any point during therapy. D, after stopping the drug. The answer is A, first 2 weeks of treatment. Remember, myocarditis typically occur early within the first month. Number 19 says, which statement best describes clozapine use in pregnancy? A, it is category X and contraindicated. B, it is considered safe. C, it is not first line but may be continued if benefits outweigh risk. And D, it should always be stopped. The answer is C. It is not first line but may be continued if benefit outweighs the risk. Clozapine is not contraindicated but used cautiously during pregnancy. And the last question says, a patient overdoses on clozapine. Which symptom is most likely? A, severe EPS. B, cardiac arrhythmias and CNS depression. C, hypertension and mania. And D, increased WBC count. The answer is cardiac arrhythmias and CNS depression. Overdose causes seizure, arrhythmias, and CNS depression, not EPS. You need to understand and remember most of this points, because these are the things that ANCC is looking. If you look at this question, most of them is about being a safe provider. So take a look at this. You can go over this, save this. If it helps you, go over it over and over again until you have mastered this clozapine exams. Remember to subscribe and follow me on my channel, because I am dropping a lot of high yield questions on ANCC and NCLEX, not just on clozapine. And I will see you in my